I was 35 years old when I was diagnosed with AML. Before that, I was having a lot of symptoms of bruising. When I was sent to a patient first, my hemoglobin was 7, and they said, you need to go home and pack and get to MCV. In the hospital after the 6 weeks, but after I was released, I went into remission for 18 months. And after 18 months, I lapsed. And then after I lapsed, I went back in the hospital, and Dr. Tom Smith, he suggested, he was real pushy. He said, I want you to have the bone marrow transplant. He said, I've been testing your brother and your sister. Your brother does not match. Your sister kept matching. She's like 99.9% match. I will believe this till rest of my life, that out of 2 siblings, 1 matched, and it was her. I've always been grateful and thankful, and I just know that God was in the picture. Her husband and her were just all gung ho and ready to be there for me.
But I can attest to she was gung ho. I did all the donor evaluations and workups and physical exams, and she was, let's do this, get it done.
Yeah.
So we moved here in mid-'87. Our first clinical procedure was in December. We did a marrow procurement, and that was a storage, I think it was an autologous marrow procurement. And then the first true transplant, of course, was this young lady here. And that was January 6th. The first year we did transplant, we did 19. And we went from, in 1992, we did about 44 transplants. I think now we're up to between 160 and 190 a year. And there's just so many more choices in treatment options. Currently, there's more choices in non-transplant options with immunotherapy and the new treatments with CAR T. Those are things that are the future of transplant, and it would actually be nice if we could even slowly work our way away from transplant, getting away from having to use someone else's cells.
I was told by Dr. Smith that I had a 10% chance. And when someone tells you that, you don't take that lightly at all. And, you know, the major milestone is to have seen my 2 sons grow up to be men. And I have granddaughters, and I have a grandson, and I have a great-grandson. And I've made myself a promise. When I got out of there after the bone marrow transplant, I would never go in and be admitted again. And to this day, thank you, Lord, I've not been in there since. 31 years.
Which is a big rarity. I mean, most all allo transplants get readmitted for something.
Very thankful. Every year my birthday rolls around. I just had one less than 2 weeks ago. I'm very thankful that I've seen another birthday because I thought I wouldn't see anymore.